Dr. Brad Conder here, and today I want to take the time to actually answer some of the most common questions that I get about physical therapy in general. Physical therapy is still not a really well-known healthcare product in the nation, actually. I find that most people don't know what it is, and I wanted to answer some of those questions today. So the very first question is, what exactly is physical therapy? Well, physical therapists in the United States are musculoskeletal experts. Now, what does that mean? That means that we are experts in the bones, the muscles, movement, and we actually have a very wide array of skills that actually make it hard to kind of describe what physical therapy is. So, for example, we can work in hospitals, we can work in nursing homes, we can work in home health. But as far as focused physical therapy, what we specialize in is musculoskeletal injuries and orthopedics. So that can be back pain, neck pain, elbow pain, knee pain, almost any pain or dysfunction in your whole body is what we can help with. And that's what makes it kind of so confusing, is people just don't know what physical therapy is. So physical therapists do handle all of those types of complaints, and we can help people move better, live better, do things better. We can, first of all, diagnose the problem. There's a little weird kind of medical terminology sometimes about the word diagnosis, but basically what we can do is evaluate the issue that you have, tell you why you have it, what it is, and how to get it better. That's our most important thing that we can bring to the table, is telling you what your problem is. You don't always need an MRI or X-ray. You just need somebody that knows how to look at your back, look at your knee, see how it moves, and tell you why that's happening, tell you what structures are going wrong, tell you how to fix it. Secondarily, we can not only tell you what's wrong, we're one of the few people that can give you actual answers and solutions to your problem. So we can do hands-on treatments, that be massage, mobilization, manipulation, dry needling. At Focused Physical Therapy, we can do all those things to help you actually manage your pain, get moving more freely. But a big part of what physical therapy should do as well is also give you the tools to help it on your own. We show you how to exercise on your own as far as range of motion and flexibility. Also, how to strengthen the right way. Sometimes, there's a big difference between strengthening with physical therapists as far as the individual muscles that you need for stability and what you're going to do in the gym. And we actually help you transition toward a gym so you can maintain that. So that's what physical therapy is. We help you diagnose what your problem is as far as your body, how you move. We can actually use our manual techniques to make you feel better right away. And then we also show you how to take care of yourself as far as your home exercises and how to keep it better. That's one of the biggest questions that I get as far as physical therapy, and it's a long answer, but it's a complicated answer that we can help a lot of people with. Second question is, does physical therapy hurt? Well, the way we do physical therapy, focused physical therapy, it should not hurt in most cases. There's a difference between like soreness and pain, and like sharp shooting pain. Our goal is to actually make you feel better. Even each individual visit, you should feel even a little bit looser, better. So when you come here, you should actually feel better the same day. Now, it's not going to be a miracle cure. Anything in the healthcare is not. That's just, if you're looking for something that's going to be a quick fix, it doesn't happen. Not because most of these things actually have taken a long time to get better. So it's not going to hurt. Our goal is to make you feel better quicker, and we can show you how to manage that. So when you are hurting, your best place to be is here. How long does physical therapy take? Well, that can vary from person to person. There are some things that can get better kind of quickly, and just with a little bit of advice. But there's a lot of things that take a lot more time. And especially with our goal in physical therapy, to actually give you the tools to last a long, long time with your self-care, meaning that if you have back pain, you can't hardly move, can't hardly sit, we're going to get that better. But also, what do you do to keep that better? What do you change in your life? What do you really do? Because these things, there is no cure to these things. And that's the way a lot of people want a cure to their problem. And I'm sorry to say, if you're looking for a cure for back pain, it doesn't exist. The options that you have for back pain there are some different options, but no matter what the options are, even if you had surgery or injections, you're still going to have to learn how does your body work, what gets you in that position, and how to get it better. And that's a long-term deal. But everybody's actual sessions can range. I've had people range from 3 visits to all the way up to 20 plus visits. Everybody's situation is different. So don't try to pigeonhole yourself into how long physical therapy is going to take, because it can be very, very different. But your physical therapist should be able to tell you in the very first visit how long they expect it to last. Do I need a referral? In the state of Kentucky, physical therapists do not need a referral to treat you for any of the common conditions that we see. Now, another thing too, the good thing about getting to us is that if you do need a referral to a doctor, we can do that for you, which is sometimes nice. That if we see something that we can't handle, as far as you need an MRI, you need medicine, we're going to send you to the doctor, and we can be that mediator for you, and that way you don't have to worry about all the time in between. So what happens in physical therapy? Well, like I said earlier, each session with focused physical therapy is going to be always a highly intense one-on-one session, to where we look at your movement, we evaluate and assess your problem so we know exactly what's going on. I can tell you what the problem is, why it happened, how to get it better. And also the session is going to include actual pain relieving techniques, where we use our hands to kind of do massage, do dry needling, whatever it takes to kind of make you feel better. And then during that session, we also teach you how to activate muscles, how to get them moving, and how to do that on your own to move toward your goals. What is the cost? Well, that's a hard question, because all healthcare is going to cost something typically. I don't always like to give that answer right up the top of my head, because I really truly don't know. Everybody's situation is different as far as what they have to pay for physical therapy, what they paid in the past using your insurance. Some people have high deductibles, some people have co-pays. It really is kind of a hard question. The main thing I would usually try to suggest to people as far as cost is that make sure to talk to your healthcare provider about it, no matter who you use, whether it's us or somebody else. Have that open conversation. People oftentimes don't even understand what their insurance means as far as deductibles, co-pays. What's my out-of-pocket costs? Most places, including us, should be able to give you a good range of what it is and give you options as far as payment. Healthcare is just going to usually cost money. Whether you're using your health insurance or not, it's just something that we have to do in the United States, and there's different reasons for that. So my main suggestion is that if you have a question about that, make sure to have an open, honest conversation as far as what you can afford, what we can do to help you with that. And we always can work with usually individuals' situation to help them get what they need, but also fit with a budget. How do I know if physical therapy will help me? Well, if you've had a lot of pain, and you've had a lot of dysfunction, and you've had a lot of different things to try to help, you've tried braces, you've tried going to the doctor, you've tried other physical therapists, you've tried a chiropractor. A lot of times there's a lot of skepticism whether something like physical therapy at our physical therapy location is actually going to help. Main thing is you need to feel comfortable with the provider you're going to. So that's why we give people a lot of time to try to get to know us. We try to talk to you on the phone. We try to give you free sessions up front to learn more about your condition. The more information you're going to get, the more comfortable and more less skepticism you're going to have to actually get a good outcome. In my opinion, physical therapy for most all situations is going to work, but you have to take the time with your provider to actually make a plan that works best for you. The way we have our sessions set up here, we do give people a lot of time, and that's where I think a lot of healthcare is lacking as far as the time to make a good plan. Everyone's plan should be different. It needs to be different, because not all back pain is the same. It's like not all other medical situations are the same. So you got to make sure it's a good fit for you. There are solutions to this, but taking the time to ask the right questions, find the person that's going to listen to you, is the key to actually knowing if it's going to work for you. And then making the mental choice to get better. Like I said, people want quick fixes sometimes, but that's not really how these things work. Most healthcare does not work that way. So trying to mentally prepare yourself where I'm going to have to make a change somewhere in my life to kind of get the goal which I want, which is less pain, more freedom, more movement, more sports, more activity. There's going to be something that needs that change, and a lot of times it's a mental thing, and always talk to your physical therapist about that, as far as if you have fear that it's not going to work for you. Because we need to talk through that. So last one is, I've had physical therapy before and it didn't work, so why would it work for you? Well, like I said before, everyone's situation is different, and everybody's experience is different physical therapy places. I've worked at multiple different places. I've worked at hospitals, I've worked at home health agencies. I give all my physical therapists the time they need to actually do the best job they can. A lot of times people go to other places where they may not have enough time to actually feel like they've been heard, if they've actually getting the answers that they need. So I try to give everybody, with me and my physical therapist, all the time we need. We've spent up to an hour, 2 hours with people just listening to their problems to try to figure out the best solution for them. That's really where I feel like most healthcare is lacking, is the time. So if you can give the time, and if we can give you the time, the likelihood of you getting a good outcome goes way up. So these are some of the most common questions that I've gotten. Hopefully we've answered some of your questions. If you have any takeaway from this, takeaway that you should always ask more questions, expect more out of us, because the more questions you ask of us, the more information we can give you, the more likely you are to meet your goal. And our goal is to make you feel better and live your life more. So make sure to ask good questions. We'll be here to answer them for you.